With wildfires burning across the state, a new concern is the air quality. You can see on these NASA satellite images just how far winds are driving clouds and smoke away from the Kincaid fire in Sonoma County. And if you live near the San Fernando Valley, smoke from the massive Tick fire is blowing over large areas as well. Hundreds of local schools closed last week because of fire and air quality concerns. So what is the smoke and air quality doing to our bodies? I'm joined by Dr. Marc Kerner from Dignity Health Northridge to talk about the long-term and the short-term effects of smoke. Hi there, doctor. Thanks so much for joining us. What are we looking at? Let's talk about the short-term first. How are people going to deal with this?
Basically, the real short-term effects are anybody that has underlying lung problems or heart problems or allergy conditions. They can certainly be severely affected by the amount of particulate matter that's in the air with these fires. Anybody with also underlying long-term, severe lung problems also are affected as well. So even people that really don't have any underlying lung disease can be affected by the smoke and the particulate matter, especially since you have so many chemicals and noxious allergens and fumes and all kinds of particulate matter that can create severe allergies, irritation, and underlying lung problems even in people that don't have it.
Are there any measures people can take to protect themselves?
Sure. The big issue is, and probably the most important issue would be doing things like wearing a mask, and you want to have a mask that's rated high enough to cover most of the particulate matter. So you're looking for something that's labeled like N95. The other thing is you got to make sure that the mask is fitting well over your nose and mouth so that it's not leaking air around the sides, which will, of course, then negate the effect of the mask. Otherwise, the other thing we have people do too is stay indoors, obviously, not exercise or try to limit their exposure outside, run a air conditioner or HEPA filter if they have one. And the other thing that they can do that we're big fans of is doing like nasal irrigations with either a neti pot or saline rinses just to get that particulate matter out of their nose and out of their upper airways.
And so let's talk about sort of the long-term issues here. Obviously, these fires, we have them every season, every October, sometimes beyond. What are people looking at in terms of the long-term effects here?
Well, again, it's the same thing. Once you start building all these toxins in the air, you can look at all kinds of severe lung problems coming down the pike. So we're going to see people with much worse asthma. People that maybe have a propensity to develop asthma or allergies are going to get much worse. We're going to see elderly people that also have underlying lung problems. They're going to suffer from this as well. And so we recommend that those people that are at high risk also get both a flu shot as well as a pneumonia vaccine to prevent some of the further complications of other illnesses that can occur.
Right, and so because we have seen such consistent fires, when you have patients coming in to see you, what are some of their most typical complaints?
Good. So the biggest thing we're seeing is like nosebleeds, asthma exacerbations, upper respiratory problems, sinus infections, nasal infections that are so severe that they're, like I said, sometimes will lead to even nosebleeds.
Wow. And so that's just a symptom of the fact that it's so dry out probably, right?
Exactly. And then the irritation just causes just destruction of the membranes in the nose.
How do you, and as you were talking about saline rinses, is that one way to kind of stave off that condition?
Yeah, so that's a thing that we use as a mainstay to help prevent any further damage from the exposure. So what it does is it helps dilute those toxins and those irritants out of your nasal passages and out of your upper airway, which is really the filter to your lungs.
The key seems like really knowing how to get that mask and which particulates that mask protects with, and not just buying one of those paper masks. Those aren't super effective, right?
Exactly. So the ones that you want to have one of those that has a government rating of N95, so like Nancy 95, and that will cover most of the small particulate matter that we see in these wildfires.
Doctor, thank you so much for joining us. That was so helpful, and I know people will probably use this advice to try and stay as healthy as they can.
Great. Thank you very much.